All right. Hello, everyone, and welcome to the Stigma-Free Society's Facebook Live event. My name is Gerry Friesen, also known as the Recovering Farmer. I am a stress and conflict management specialist working out of Manitoba. Because of my own journey with mental illness, I have a real passion in talking about it because it is in talking to others we can find a path forward for ourselves. You can learn more about me by visiting gerryfriesen.ca. Through this Facebook Live event, I am representing the Stigma-Free Society, which is a Canadian registered charity that aims to reduce stigma of all kinds with a focus on mental health. This event is a part of their Rural Mental Wellness Toolkit, an online community-based mental health program that creates access to mental health education and peer support training, as well as practical and relatable resources for those living in rural and agricultural communities. You can find the toolkit at ruralmentalwellness.com. I'm excited today to have the opportunity to chat with Briana Hagen. And I think with all due respect, I need to call her Dr. Hagen. It certainly is a pleasure. I had the pleasure of meeting Bri back in January, I believe, when I helped co-facilitate some of the In the Know workshops, and I look forward to hearing more from Bri about that. So welcome, Briana.
Thanks for having me, Gerry. I'm excited to be with you.
Oh, perfect. Just I was going to say a short bio, but we've got an awfully wise person with us here today, so I'm going to read this. After completing her Master's of Science in Community Health and Epidemiology, Briana completed a PhD in the Department of Population Medicine at the Ontario Veterinary College at the University of Guelph, working under the supervision of Dr. Andrea Jones-Bitten. Her PhD research involved using both quantitative and qualitative research methods to better understand mental health and well-being among Canadian farmers. Using both survey and qualitative data, she examined how farmers and their farms are impacted by mental health outcomes with a focus on perceived stress and the barriers and facilitators of help seeking for farmers. Briana is passionate about collaborative research approaches and building strong partnerships with the agricultural community to co-design research projects. After completing her PhD in July 2020, Briana began a Mitex Elevate postdoctoral fellowship to continue her investigations around farmer mental health in Canada. And very clearly, farmer mental health is a passion of mine, Briana, so I certainly look forward to chatting with you.
Me too.
So how about we start, and can you start by telling us what got you interested in researching farmers' mental health?
Sure. It was actually a bit of a roundabout way that I came to research farmer mental health specifically. I have been researching mental health and more like psychiatric epidemiology since I was in my undergrad, so for many years. And I was working with many different communities, but I hadn't worked with farmers yet. And then it was, fate or circumstance that brought me to Andrea.
Okay.
And I was considering whether or not I wanted to do a PhD. I really wanted to stay in the mental health, psychiatric epidemiology, co-designing projects. That was kind of my passion. And she said, well, have you ever considered working with farmers? And I said, well, do farmers want to work with me? What do we want to do here? And so we kind of just talked about what was going on in the community, or anecdotally what she had been hearing as a veterinarian who worked with farmers. And our skill sets kind of merged in a way that was really quite nice. And I said, well, my passion is making sure that we're addressing these research questions with the community. And I don't come from an agricultural background, so I'm not sure I'm the best person to do this. And Andrea said, go meet with a farmer and talk to them and then decide. So I did. And I met with a few farmers and chatted. And what I found out was that this was the perfect spot for me. Farmers are so willing to teach you about their farms and what they farm and how they farm, as long as you're willing to listen. So that's kind of how I came to this realm, and I can't anticipate ever leaving.
Oh, that sounds so good. And you know what? Farming is that interesting culture. And when you talk about how willing farmers are to talk, as a farmer myself years ago, but even now still talking to farmers, if you can talk their language and, like you say, listen, I mean, they're more than willing to share, and it's so helpful in the work you do.
Yes, definitely. It certainly is.
So you talked about a little bit about some of your personal life and how that affected some of the decisions you made in regards to getting into the field, particularly in this area. Is there anything else there that you want to share?
I don't think so. I think, I've been working in the mental health field for a really, really long time, and it's my passion. And, I hope that we're continuing to do good work, but I think I just about covered it.
Oh, perfect. And you know what? Now we're getting to the subject that I wanted to talk to you about. I know I've used the statistics from the survey you did in 2016, compared it to a survey that the Canadian Agricultural Safety Association did way back in 2006, I believe it was. And so just, can you tell our viewers about that 2016 survey that you and Andrea did?
Yeah. So actually, Andrea conducted that survey right before I came on board.
Oh,
So
okay.
all props to Andrea.
Okay.
I jumped in when she had already done the hard work of collecting that data. So back then, when Andrea kind of wanted to investigate, anecdotally, she had heard about some mental health struggles in farming communities, particularly in Ontario. That's where she was based. So she wanted to, as an epidemiologist, as any good epidemiologist would do, let's collect some data. So she designed a survey and was looking to get about 300 participants to start to look at, okay, well, what are the prevalences of depression, anxiety, burnout? What's the level of resilience, chronic stress, those types of outcomes? And when she sent out the survey, it blew up and went across Canada. So we ended up having just about 1,200 farmers participate in that survey that we were anticipating or hoping for about 300. So an overwhelming response, which I think speaks to the need in the community and the engagement of the community. But what the results of that survey showed, that was the part I was a part of. What we found was the prevalence of high stress was incredibly high. Depression and anxiety were experienced at levels that were significantly higher than the general population and other occupations. And burnout was significantly higher than the general population, and resilience, which I think this was the most surprising part, just for me as someone who is newer to the agricultural community, levels of resilience were significantly lower than what we see in the general population. So we knew that there was things that needed to be investigated further.
Yeah. Can you make any comments, Bree, about, and you made the comment, and I sometimes address this when I talk to people, but why is there such a difference between the farming community and the other demographics and the other occupations?
Yeah, so that's the $1 million question, right? I think some of it comes from the uniqueness of farming itself. Farming can be a large business or a small business, but there are unique aspects of that are different than other small businesses. Some of these pressures that come from having a legacy of your farm that's been handed down generation to generation, and not just a business that's been handed down, it's a way of life.
Yeah.
There are layered pieces there that can really impact your mental health if things start to go sideways. And then when you layer on top of that some of the issues that have come up related to the climate crisis, having to change the way you farm, the increased amounts of money it takes to farm, what that means in comparison to what your grandfather did on the farm, it's a lot that can really impact your mental health if you aren't aware of how to manage it.
Yeah, absolutely. The one thing, and again, that really blew me away in the results of that survey was that 58% of the participants in the survey would meet the criteria for an anxiety classification, I think is the way it's worded. I mean, 58% is a huge number.
Yep.
But can you just kind of talk about that and what it actually means to meet the criteria?
Yeah, so I guess thanks, Gerry. That's actually a really good point. One of the things that we need to remember when we're looking at these surveys is we're not providing someone a diagnosis, right? We used validated scales and tools that can measure how a person self-assess how a person is doing. But we would never ever say 58% of the people who took our survey had anxiety.
Right.
We wouldn't want to say that because it just might not be true. It might, but it might not. These are, diagnostic tools that are used in hospital, but this was a validated tool to begin to understand that. So there's a really important distinction when we're looking at survey data. We are not getting a diagnosis from a psychiatrist.
Right.
But 58% on a validated tool is very high.
Yeah, it is. And that's why it just blew me away when I saw that number, because when you talk about 58% meeting that criteria, you still have probably a significant amount of farmers that are close to that.
Yep.
So that tells you that there's a large majority of farmers that are feeling, probably in a lot of cases, overwhelming anxiety.
Exactly. Yeah, that's exactly it. So that's a big number, right? So there are things there that we need to investigate further. We tried to do that, or we have been doing that as we move forward. That survey was kind of the first step in our research. And we've taken additional steps since then to try and get into more of the context, because it's really hard when you're using strictly a survey tool and you get this type of result. It's really hard to tease out, well, what is contributing to that? What are the factors that protect people against being classified as having anxiety versus not? And some of those variables we just haven't captured in a survey, or when we capture them, they might actually be related to something else that we haven't measured. So that's where it's really good to use both quantitative and then qualitative.
Right. Yeah. And part of the reason that, I guess, number one, is I was surprised by this, but I think the point really hits home is very often when I've talked to farmers in the past, they will kind of feel alone with what they're experiencing. And I think here, just the results of that survey, there's a message here for everybody, is that, hey, you're not alone. There's a lot of people experiencing the exact same thing you are.
Yeah, absolutely. And I do think the agricultural community more broadly since I've become a part of it, so over the last 5 years or so, have really put a concerted effort into making sure that we're starting to have those conversations. So hopefully that's helping some people realize that, these things that you're experiencing around your mental health are things that many, many other people are also experiencing.
Yeah, for sure. And of course, that leads me to the question of, what the Stigma-Free Society does is remove the stigma, right? And we know, and I think back even to the years when I was dealing with the mental health issues on the farm, and there being a certain stigma attached to it. Did anything come out of that survey that kind of addressed, the fact that there is stigma, or is that something that's reducing? Is it still a concern out there?
Yeah, I think it is still a concern. I do think that we have these efforts that are ongoing to reduce that stigma in the community. Within that 2016 survey, we asked questions more around help seeking. But one of the results that came from that was that there was a good proportion, I can't remember the number off the top of my head, of producers who said they would not be willing to seek help for a mental health problem because they were concerned with what others would think. And then when we did our qualitative piece of research as well, we talked about that and barriers to help seeking. And stigma was definitely something that came up, maybe not using the word stigma, but talking about, I don't want to go seek help for mental health if I know someone in my community could see my truck sitting in a parking lot.
Exactly.
And so, stuff like that. So that stigma definitely still exists.
Yeah.
I do think we're working pretty hard to try to reduce it. And I hope that that's happening, but there is always more work to do.
Yeah, absolutely. And I appreciate the work you are doing. So that leads me to my next question, and I know I've been bugging you for a few months on this. I know that you have Guelph and you heavily involved in this, have done another survey, or the survey was sent out to farmers back in June, I believe. I know you told me before we started that you guys are still working on compiling the data on that. Is there anything you can share on that?
I can share that we are working on it. Yeah, we collected data in the fall this year. And, we wanted to give farmers the longest opportunity, because we all know how farm work goes, right? Like, there are certain times where you just don't have the time to be able to take a survey. So we did leave that survey open for quite a long time. But now we are in the process of analyzing that data. We've remeasured the outcomes that we measured before. So we're going to be able to talk a little bit about, okay, this is what was going on in 2016 in that snapshot. Now, what's the snapshot of 2021? So we are currently working on that. So I'll have a lot more to say about it in early 2022. But I can say that as we've started to look at the prevalences again, we are still concerned that farmers are experiencing some of these mental health outcomes at increased prevalences compared to normative populations. And in addition to that, we did collect some data because, I don't know if you've noticed, but we're living through a pandemic, and that has really impacted things. So, collecting data during a pandemic, we had to make sure that we were accounting for the pandemic as well. So it's an added layer that we have tried to account for and will be discussing as we come out with more of these results in the early months of 2022. But it's the pandemic has been hard mentally for everybody, and that includes farmers. So kind of trying to suss out what's going on there is an added challenge.
Oh, I can only imagine. And I just think back to when this pandemic started, and I would read stories. I follow farmers on social media, and you would start hearing about, initially not being involved in the farm anymore. I wasn't sure how this would affect them, but when you start hearing how the pandemic affected them as well.
Yeah.
And then, of course, this year across the prairies, a lot of drought areas.
Yeah.
North of Winnipeg, there was a grasshopper infestation. BC, we know what they experienced this summer with extreme heat. And now, of course, in the last while, they're dealing with floods. So there's all this ongoing stuff happening, and it just doesn't end. And I mean, I almost start feeling anxious just talking about some of these things, and I'm not involved in it.
Absolutely, Gerry, you're totally right. And that's actually interesting that you talk about some of that, because, some of those climate related catastrophes that are happening, there's really quick effort to help with the communities and help what you can see and touch and help to fix. But sometimes the mental health related trauma that happens is something that people don't think about until after, or until there are big problems that farmers or their communities are experiencing. And that's part of the struggle. So fortunately, we had another piece of research that included developing an emergency response model that was for a crisis like that, but also had prevention, intervention, not just postvention. So we're trying to make sure that we're connecting with communities so that they have access to that. And moving forward now, one of our focuses for 2022 and beyond is we're starting to look at those mental health impacts of the climate crisis, and seeing how we can help there too.
Yeah, and you know what? Again, I don't want to belabor the point, but just when I looked at all of what was happening in the Fraser Valley with their flooding, when you get livestock involved and the amount of livestock they lost because farmers are we sometimes talk about they're connected to the soil, right? But
Yep.
a connection to animals as well, and just the devastation of that. But like I say, we could talk about that for a long time. But what I'd really like you also to touch on, Briana, and I talked at the outset about having met you when I was co-facilitating these In the Know workshops.
Mm-hmm.
Can you talk about In the Know workshops, kind of what you've experienced with that? I know actually that we actually did some of these, or Kim and I also did some of these for folks in BC. But
Yeah.
kind of talk about what you learned through, what the workshops are about, what you learned through that, and are there going to be ongoing workshops?
Yeah. So In the Know was, again, kind of an unplanned offshoot of the data that we collected throughout my PhD. There was a glaring hole that needed to be filled when it came to mental health literacy. So what I mean by that is the ability to recognize signs and symptoms of a mental health struggle in another person, knowing how to approach a conversation with a person. How do you ask them about their mental health? Many farmers that I spoke to talked about, well, I noticed X, Y, and Z about my neighbor, but I didn't want to make it worse, so I didn't say anything, or I had no idea what to say, so I didn't say anything.
Yeah.
And there was a want for tools to be able to do that. And to know, like, then what? What if I do ask someone about their mental health and they're like, yeah, it's tanking. What do I say after that? So we looked into getting mental health literacy training, kind of like a gold standard mental health first aid training to farmers. And while that program is amazing, it just didn't quite fit for the community. There were some logistical challenges and content challenges that farmers faced when accessing that information. So we developed a new one called In the Know. Everything was rooted in agriculture. So the content was informed by our research and then also informed by our farmer stakeholder working group to make sure we're hitting the topics and mental health outcomes that they really found were important, and doing it through an agricultural lens.
Yeah.
Yeah. So we piloted that program in Ontario, got about 100 participants, and followed them over 6 months to see, okay, did they learn about mental health, and did they keep that gained knowledge over time? Did they feel more confident in being able to see those signs and symptoms, to have a safe conversation, and to know what to do if you're having that conversation and something comes up? And what we found was that the program worked, which was great and wonderful. So then the next step from there was to push it out nationally. And that's what we're doing right now. So like you said, we were involved in getting the Manitoba In the Knows off the ground in partnership with CAP and Keystone Agricultural Producers. We now have a permanent partnership with Canadian Mental Health Association of Ontario, and they are responsible to deliver In the Know sessions across Ontario. And we've also delivered sessions in Nova Scotia, in Alberta, and in BC. I think that's it right now. We're currently working on getting them into PEI. So this is an ongoing effort, but it's hopefully here to stay, which is amazing. And one of the things that I didn't mention about In the Know that makes it unique as well is that it's delivered by a mental health professional so that it's safe, but it's also delivered by someone who is from agriculture. So sometimes you get a wonderful coincidence. Someone like Kim can deliver this, where she's a mental health professional and she's from a farm, or Deb. But, sometimes that just doesn't exist in some of these farming communities. So then that's where we work to partner them together. So, having someone like yourself co-facilitate with someone has been very successful. So we'll continue on with that.
Yeah, I've heard a lot of good things about those workshops, or how participants felt about that. So that's awesome news. Again, we could get into a lot more detail about them, but well, if people want information on that, is there a place they can go to?
Yeah, if they want information on In the Know, they could go to our, we have a lab website, and they can get more information there. And I believe it is ajbresearch.com. I'm going to double check that for you though, so I don't get it wrong.
Okay.
And I'll send it to you after, but I'm pretty certain that's what it is.
Yeah. Okay.
And as well, you can check on CMHA Ontario's website. They would have a lot of information there, or organizations that we've partnered with, like AgSafe BC or CAP. They would probably have information that you could reach out through them as well.
Absolutely. Perfect. That's good information, Bree. Thank you. So maybe the last question. I know we're running out of time here. Those 30 minutes go by awfully quick.
Yeah.
I think one of the things that we sometimes don't talk about that much is we just talked about how farmers often feel alone, but they're also part of a community. Yes, the large community is the agricultural community, but they're also part of this closer knit community. What can rural communities in general do to ensure that stigma surrounding mental health doesn't impede folks from seeking support?
Yeah, that's a great question. I've thought about this. I think there's several things that people can do. One of them is to not perpetuate that stigma by being an unsafe person to talk to. And one of the ways to combat that is to take a mental health literacy training, whether that is in the know or mental health first aid, just to equip yourself to know how to have these conversations and know a little bit more about what's going on in your community. I think that's a crucial step
Yeah.
in the right direction. And then making sure that you are an advocate. We can't do all these things alone, and we can't do them in silos. So making sure that people know that you are a person that can be talked to and trusted, and that you realize that stigma associated with mental health is just, it's not appropriate. And saying it and calling it out where you might see it is helpful.
Yeah. Yeah, and sometimes it's so basic too, isn't it?
Yeah.
Where you talked before about, if they notice a neighbor not doing well, and how do I talk to them?
Yep.
Very often it isn't even about providing answers. Very often, and I often relate an experience I had when I was in the depths of my depression, where a neighbor dropped by, and it was as simple as just sitting and listening to me talk. So I could just, and he normalized and validated, and if we can do that for our neighbors, for fellow farmers, it's so incredibly helpful.
Absolutely. And I really do think having some sort of mental health literacy
Yeah,
training in under your belt helps you even just to listen.
without
Teaching
question.
someone how to listen without providing solutions. Farmers tend to be fixers. They get out the duct tape and they want to help. And sometimes you don't need to do that. And that can be a really, really hard skill, but it's something that can be learned, right? So I think learning that sometimes it's okay to just drink your coffee and be quiet while someone talks, and you
Exactly.
don't need to fix it.
Exactly. And I think those are probably wise words we can use to end this today, Bree. Thank you so much for joining us. Again, you're just a wealth of knowledge, and I always enjoy when I can learn from people like you. And so, again, appreciate the fact that you agreed to this. Just to end off for our viewers, thanks everybody for joining us today. And again, Bree, your insights into mental health and wellness have resonated with me, as I'm sure they have with our audience. So just so people know, hey, I hope from today's session, you know that you're not alone. It's okay not to be okay. It's okay to talk about it, and make sure you do, because there is hope and there is relief. So thanks again,
Absolutely.
Bree. I hope you have a good
Thank
day,
you,
and
Gerry.
thanks everybody for watching. You all take care now. Bye-bye.
Take care.